How is everybody doing? Welcome back to another episode of The Banker Next Door. I am your host, Dr. Joe Berquist. Today, I wanted to look at a special article that came out that was basically talking about the growth of government payments and how basically, government payments, government subsidies are the fastest growing source of income for most Americans, but in particularly our older demographic in the country right now. So I'm going to bring in this article here. So this is an article from the Epoch Times, and this is titled "Government Payments Become the Fastest Growing Source of Income from this New Report." Now, this report is from the Economic Innovation Group, EIG, which is a public policy research organization, which we're going to talk about here in a second. But it basically says all of government assistance payments in 2022, 56% went to the elderly, mostly for Medicare, the report says. Now, I'm gonna break down real quick kind of the parts of this article. So we're gonna go in, we're gonna go through the beginning here. Then it gets down into kind of public finances under strain, and then it gets into aging, shrinking populations. And then it goes into economic security versus prosperity. And then finally, it offers some potential solutions here at the end. So, and I wanted to break that down real quick because this is a little bit of a longer article, but I'm going to try to move through it here pretty briskly. So it starts out by basically saying payments from the government have become the fastest growing source of income for Americans, according to a new study. A report by Economic Innovation Group, EIG, a public policy research organization titled "The Great Transformation," states that Americans have become substantially more dependent on government support, with the share of national income coming from transfer payments more than doubling over the past 50 years. Transfer payment programs include Medicare, Medicaid, Social Security, unemployment and disability, food stamps, and veterans benefits. Transfer payments increased from 8% of U.S. total income in 2017 to 18% today, the report states, crowding out private income from wages and investments. There is a large range of experiences driving transfer reliance across communities. Benjamin Glasner, an EIG economist and one of the report's authors, told the Epoch Times. But it's unavoidable to look at the fact that transfer reliance has grown rapidly across the country, and it's something we need to deal with. According to the Federal Reserve data, government transfer payments increased from about $70 billion in 1970 to more than $6 trillion in 2020 during the COVID-19 pandemic, before falling back to the current level of $4.3 trillion. I mean, still, that's an insane number. I mean, think about that. In 1970, you were talking about $70 billion. And now we're talking about 4.3 trillion. I mean, think about it. I mean, that's just, it's hard to comprehend that number. To go in basically 50 years' time from 70 billion to 4.3 trillion. I mean, that's mind-boggling. According to the EIG report, if government transfer payments were spread evenly among all Americans, they would have amounted to an annual amount of about $11,500 per person in 2022. One factor driving much of the shift from private income to government dependence is that the U.S. population is on average getting older. According to demographic data from USA Facts, the percentage of Americans 65 years and older increased to 17.3% in 2022 from 13.1% of the population in 2010. During the same period, the percentage of Americans younger than the age of 20 fell 24.4% from 26.9%. The primary driver that we found in our report is demographic related, specifically the fact that the country has aged so rapidly, Glasner said, and the transfer programs that target that aging population also have grown significantly more expensive over time. Of all government assistance payments in 2022, 56% went to the elderly, most for Medicare, according to the EIG report. Healthcare costs were a major factor, both because more Americans qualified for Medicare and Medicaid, and because the most of medical treatment rose significantly. According to data compiled by Peterson KFF, a healthcare policy analyst organization, total health spending in the United States was $74.1 billion in 1970. By 2022, total health spending was $4.5 trillion. Again, a kind of a mind-boggling number. Now, there's a couple of things I want to say on this. First of all, when we talk about the older population, we're probably talking about the silent generation that's still hanging on a little bit, mostly baby boomers who are now, anywhere from 65 to 85 years of age. We're talking about, the Gen Xers, the oldest Gen Xers that are just starting to get into kind of that 60 to 65 year range. That's a kind of the older generation. But I think there is some good news there because, your millennial generation is bigger than the baby boomer generation. Gen Z is also, I don't know if Gen Z is quite as is bigger than millennials, but they're not far behind. So I think you put kind of Gen Z millennials together and you got a pretty sizable population there coming in behind the older generation. So I don't think it's time to hit the panic button yet, but I think some of the other bigger things that this article doesn't necessarily tackle is that it's the growth of the welfare state. It's the growth of people that are on disability. One of the key things that I've looked at in the last few years that I found so fascinating is the number of disabled Americans that have absolutely spiked since COVID. If you look at the numbers from 2021 to 2024, you've seen this massive spike in, I think it's almost about an additional 1.5 million working age Americans have now gone on to disability, which is just a huge number. And that's again, that's very troubling. The welfare state, obviously, with the illegal immigration that have come in, just enormous expansion of the welfare state in general. So, and then I did see another report a number of years ago before COVID that basically said that out of 300 and I think about 6 or 7 years ago, the population estimated about 315 million people in the U.S. That out of that population, literally almost 50% of the population was receiving a check from the government every month in some way, shape, or form, whether it would be Medicare, Medicaid, Social Security, welfare recipients, whatever it was. But like literally 49.8% of that population at that time was getting some kind of check from the government. So it's not surprising that this is the largest source of income. So then it goes on to say basically public finances are under strain. No shock there. And then we come down, we basically see, again, the aging, shrinking population, we kind of address that. Now, economic security versus prosperity. So the increasing dependence on the government for income raises the issue of how the United States can balance economic security for its dependence against overall economic growth and prosperity. The increased politicization of life will put a damper on economic prosperity. For every dollar taken out of one taxpayer's pocket and put into another, there's a cost, an excess burden. This burden is the result of distortions thrown into the economy by imposing a tax and the administrative costs of levying the tax and of running the government's transfer payments system. Arthur Laffer, a noted economist who specializes in tax policy, wrote in his 2023 book, Taxes Have Consequences, an excellent book, by the way, which I will be reviewing, that raises taxes much beyond current levels will choke off economic growth, thus reducing the tax base. Arthur Laffer is a noted economist. He's come up with, I could do a whole episode on Arthur, but you should definitely Google him sometime. He's a fascinating individual to look at, but he's done some great things in the economics field. But the more you redistribute, the greater will be the drop in total income, Laffer said in a 2023 interview with the Epoch Times. Consequently, governments are increasingly caught between a rock and a hard place regarding how to pay for social programs. And obviously the ballooning national debt. Now, what can we do for potential solutions? So according to Glasner, there are 3 options for governments to continue providing transfer payments. The first is cutting benefits, but that appears to be politically untenable, and neither Democrats nor Republicans have expressed any interest to do so. The second is raising taxes, he said, but there's some risk to that because overdoing increases in taxation can potentially cut off sources of economic growth, undercutting our actual capacity to deal with this. The third and most viable option, Glasner argues, is to increase economic growth and private income. Among the ways to do this, he says, are investments in research and innovation, better designed immigration policy, and tax and regulatory policies that foster economic dynamism and increased participation in the workforce. Although the United States financial situation may appear dire, a September report from the Manhattan Institute titled America's Surprisingly Effective Welfare State argues that the United States is in better shape than many other Western nations. While Europe's social programs provide support payments regardless of need, the U.S. transfer systems are more selective and thus less costly while delivering more money to the poorest. Yeah, I'm not so sure about that one. Um, and it concludes by saying basically Europe's welfare states are dominated by costly public funded social insurance programs, which attempt to fully support middle class lifestyles through periods of unemployment, ill health, disability, or retirement. The report reads, by contrast, American public entitlement programs are more focused on providing a safety net against poverty, and they more strictly limit eligibility for cash and healthcare benefits to those who are unable to work. Yes, in a certain regard, but not entirely. I find this article very interesting, and I wanted to bring this up because I think it gets to the heart of some pretty deep issues at sitting at the heart of our country right now. And I think that we do need to cut taxes. We do need to reduce the welfare state. Higher taxes is not the answer. We need to reduce taxes, and we need to get economic growth churning. We need to get people opening up more small businesses. We need to get companies growing. We need to make it just cheaper for people to run their businesses. We need to cut red tape. We need to cut bureaucracy. And doing all that, reducing regulation, that will spur growth. And the more growth you have, the better economy you have, the easier it is to get people off of, welfare, because there will be, when jobs are plentiful, people have more economic opportunity. They can get a job, they can get a decent paying job, they can get off welfare. That again, reduces the tax burden to the tax paying base. You just get to a point where it's like, our system is supposed to work as a safety net. It's not supposed to be an end all be all. Like Social Security is supposed to be a supplement to retirement. It's not supposed to fully, it's not supposed to fully cover you in retirement. That's not the idea. Like, you're supposed to save money toward retirement. Now, again, there's a lot to argue there about pensions and 401ks and all. I get all that. We could talk all day about that. But I'll save that topic for a kind of, another time. But I just think that this article did a great job of pointing out, again, that there are just kind of major issues at the heart of our economic system right now. And we really have to work on these issues because, if you get too many people on the welfare state, you get too many people depending on the government, and our demographics work against us, that's going to lead to a horrible situation where you will have to cut benefits one day, whether the government wants to or not, because you just won't be able to afford them. And then what does that mean to everybody? What impact does that have upon society? So again, hopefully this was an interesting and stimulating topic. Hopefully it gets you thinking about some things. And I will wrap up by saying, if you like this episode, please make sure to like, share, and subscribe, as that always helps the channel. Remember, we are on YouTube, Rumble, and all major podcast platforms. Please be sure to leave your comments down below, as I always love getting back to everybody. And make sure to check out some of the other content on the channel. And I will see everybody again real soon. Thanks a lot.